Thank you, and thank all of you for being here for the words. And Pastor Warren, let me finish out that conversation. Have you seen effective outreach from government reaching out to the faith sector in any particular country that you've been around, that your church members have worked with, that you've seen that connection, whether it's with the United States government or with other governments? Where's a model for that?
Oh, well, I've actually found it quite easy to work with other governments. They're not nearly as afraid of the church as the American government is. I mean, we work with governments literally all around the world, and they're very, very friendly because they realize we're not trying to do their work. Everybody has a different role to play, and the church's role is not government, and the government's role is not church, but on health issues and on education issues and on development issues, you can team tackle. So, as I said, I've just found it very easier to work with governments overseas.
Yeah, it is ironic that we have distributed around the world this concept of freedom of religion and disconnect between government and faith, and to say that government doesn't oppose faith, but now we suddenly become like we're afraid of faith and to be able to partner. And it seems that that is an obvious area of partnering. When you talk about the number of hospitals and number of clinics versus the number of churches, and I hear our experts on the medical side say one of the key things we have to have is a distribution center in that location. How do we get that? I mean, I think we can't be afraid here of saying there's an obvious connection there. And where we can connect and where we can find good distribution and relationships, let's do. It seems to be one of our greatest challenges of getting to these areas with a relationship that is a trusted relationship. To say this is a way to be able to deal with this disease or to be able to deal with this cultural issue, and let us engage with you in a relationship. So I appreciate all that you're doing on this. Let me shift a little bit. I am a little concerned, and this is one of the things that we deal with all the time, dealing with the funding side of what we're doing on this. The Global Fund received $1.3 billion in FY15. We have $4.3 billion for State Department's HIV/AIDS program, $330 million for USAID for HIV/AIDS programs, $128 million for HHS AIDS and HIV programs through the CDC, and $451 billion for NIH global research. My question is, how are we doing on coordination? How's everyone doing talking to each other to make sure that everyone doesn't raise their hand and say there's a problem, and we all agree there's a massive problem? How's the coordination of that dollars going? Does everyone have their lane, doing their job, or do we see duplication? Anyone who wants to jump into that, have at it.
Well, Mark and I can answer that together. It's interesting how you put it together, and thank you for framing it that way, because you talked about our boss, because we both were in Tony's lab at one time, and then the way we work with both the NIH and the Global Fund and how we leverage. So we work very closely, obviously, with NIH. They both support scientific development and capacity development in Africa with us, as well as key research that we need. And they, thank goodness, are working on an HIV vaccine and have a meeting this week on that. And we're very excited about the progress they're making. I think what was missing is the level of absolute working together at the Global Fund. And over the last 18 months, that has really transformed into a almost daily texting, unfortunately for Mark. We're in constant communication, but we're in constant communication at every level within the Global Fund.
Okay, so
at
let me
every
ask,
country
how did that happen?
We just committed to it.
Well, in part, perhaps because I was at PEPFAR at the beginning and Deb was there soon after, and part of its relationship, but part of it's just an evolution globally and in country. We have no in-country presence. We are a financing mechanism. We are a leverage mechanism to ensure that people will come together to finance. And so we raise money. For the 1.35 you put in, we spend $4 billion a year on HIV, TB, and malaria, and we raise it from all sectors. And I have to say, you know, to the chairman's comments, without that leadership from the U.S., it will unravel. Really, it's the U.S. that does it. Then when you get to the country level, we work as a partnership. We bring also the multilateral partners, the UN institutions, other donors who have in-country expertise to work collectively, the faith community in countries, the private sector in countries. So we have forced ourselves together for impact and to get you value for money, because we can't achieve it any other way.
Right. So there's the obvious issues here, and I want to keep pressing on this because we deal so much with the finance side. When we do the emergency funding for Ebola, it's $2.7 billion. We sent 3,000 folks to that area to build 11 different Ebola centers, and if I remember my number correctly, we had 28 people that we ended up treating with $2.7 billion. Uncoordinated, too late, massive response, delayed. We can't have that in a disease like AIDS. We can't not have coordination, not have interaction, and make sure every dollar is spent wisely. Now, should we have responded to Ebola? Yes. Did we do it in the most efficient way? I think time's going to tell us no, we didn't do it in the most efficient way. So I want to come back on that again. Is there a structure in place, and I'm proud of the two of you, I mean, to say it that way, that you're working on making sure there is lots of communication. Is there a structure in place to make sure that this is ongoing? I hope y'all stay at it and that y'all work yourself out of a job soon, quite frankly. That would be terrific news. But how's it going building the structure to make sure that's maintained?
There's a structure now at every level. So, and I think part of it has to do with leadership and sending that signal very clearly down to every level that we will work together, and we will work together not only in concert at the headquarters level and at the implementation level, but at the principal recipient level. The Global Fund's money go through a principal recipient. It makes the principal recipient sometimes nervous how close our dialogue is about what precisely is the Global Fund doing and what precisely PEPFAR is doing. And we can line that up and marry that information in an absolute clear and transparent way. And that's what's new. And it's what the Reverend talked about, data and data collection and transparency. That's what will ensure that there's not duplication, because we now know down to the site level where his dollars are going and where our dollars are going.
Okay, thank you. Keep going on that. Y'all are doing some great work and raising funds and raising awareness and staying engaged in this, and we appreciate it, and we'll continue to partner to try to help in what we can do as well. Thank you.
Thank you. That's an excellent line of inquiry that we'll follow up on. Senator Merkley.
Thank you, Mr.